Welcome back to Derm Time. I'm Dr. Hajan Ko.
And I'm Dr. Nkema Ganavo.
And today we're going to talk about eczema because I don't know about you, but I'm itching and dry skin all over.
I am a little ashy today, I'm not going to lie.
It's eczema season. So we'll talk about what triggers eczema and what type of skincare products to use, the type of skincare routine that's appropriate for eczema-prone skin.
So if that sounds good and interesting to you, don't forget to follow us, hit that subscribe button, and please give this video a thumbs up. Yay! So Dr. Ko, what is eczema anyway?
So eczema, also known as atopic dermatitis, is a chronic inflammatory skin condition that affects millions of people worldwide.
Yeah.
It can show up as dry, itchy patches that can often affect like the folds here and also back of the knees, but it can also be anywhere on the body.
Is it more common in like children or adults?
I would say it's more common in children, but we do see significant number of adult patients with eczema flares.
Yeah.
So it can continue on without stopping.
Yeah. And contrary to popular belief, it is not contagious. So sometimes when people get eczema flares, it can look pretty bad on the skin, but it's not contagious. It's not something that you can pick up from other people. However, it is something worth treating because it's persistent, it's frustrating, it can really affect quality of life for those that it impacts. And so for many people, it's a lifelong condition that requires ongoing management. But with a good treatment plan, it is very manageable and it can help improve quality of life for those who suffer from it.
Yeah, and there's many different types of eczema. One of the most common ones that I see these days is like the bubbles or dyshydrotic eczema on the fingers and hands. It can be very difficult to manage, and I have a lot of patients kind of suffering even with the use of medication sometimes, just because we use our hands all the time, you know? And it's really important to be able to manage the condition so that we don't end up with like open cracks on the hands and dry hands that can really keep you up at night.
Yeah, another type that's pretty popular is nummular eczema. Get these almost like coin-shaped lesions on the skin. Often gets misdiagnosed as ringworm, actually.
They can look similar.
They do look pretty similar, but in contrast, this is not a fungus. It's just eczema that's shaped like a coin. But that's something that comes up quite often, especially during the winter. And it's always good to know what your triggers and your symptoms are so that you can avoid it and hopefully help deal and reduce the amount of flares that you get. So one common question we'll often get from patients is, what causes eczema? Like, why do I have this? Why is it happening to me? And unfortunately, it doesn't have a very precise answer. So the exact cause of eczema isn't really known, but it's thought to be a mix of genetics, perhaps your immune system, and of course, environmental factors. We do know that people with eczema tend to have a weakened skin barrier, which means that their skin loses moisture more easily compared to those who don't have eczema, which makes your skin more vulnerable to irritants and things from the external environment.
Yeah, and we can't change our genetics, unfortunately, but we can definitely control our environment. So especially in cold, dry season, like you want to make sure that your environment or the space that you're in is free of allergens. You want to avoid anything that might be inducing the trigger. And also the use of humidifiers can be helpful to keep the air kind of more moisture in the air so that your skin is not too dry.
And for people with contact dermatitis in particular, you want to identify and make sure that you are aware of what your triggers might be so that you can avoid those triggers and avoid those irritants. For some people, it might be things like nickel or other metals, fragrances, etc. If you know what's causing you to have irritation when it comes into contact with your skin, you want to avoid it so that you reduce the chances of that happening.
So one of the common triggers, especially in the winter season, is hot showers. Taking hot shower can trigger itch in the skin, and which can trigger and perpetuate eczema flare-ups.
Yeah, and I know it's tempting, right? Because it's cold outside, so naturally you want to crank up the heat as high as you can and stay in there. But it just
trust us, we know it's hard.
We know it's hard. And in contrast, I'm not saying that you should do cold showers.
Right.
But just go for lukewarm.
Somewhere in between.
Exactly. Because when it's super hot, it actually dries out your skin, and then you have to kind of like start from scratch in terms of adding moisture back.
And make it short, nice and short. Less than 5 minutes is what we typically recommend. The longer you're in the water, the drier your skin becomes when you come out. So always make it short and moisturize right after.
So when you do come out, if you could even keep a little bit of dampness in the skin, and then add a moisturizer onto your damp skin, you will find that the skin absorbs it better. So we always recommend applying a moisturizer on slightly damp skin after the shower. So if you have eczema, what are some recommendations that we can make to help manage it? So moisturizing is a huge part of your eczema treatment, and it's important for anyone dealing with eczema to know how to best moisturize their skin. We recommend using a thick, fragrance-free moisturizer that you're gonna apply at least twice a day. And I often will tell patients to look for a cream rather than a lotion. It's not that lotions are bad, but they're more lightweight, so the creams are gonna be thicker and usually do a better job of moisturizing your dry, eczema-prone skin. You also wanna look for ingredients like ceramides, which help restore the skin barrier, and humectants such as glycerin and hyaluronic acid that help draw moisture into the skin.
And for flare-ups, we do kind of go to medical management. There are creams that we use. Some of them, of course, are topical steroids, but we also have non-steroidal options for maintenance regimen. In severe cases, you know, when you have eczema all over the body and it's not being adequately managed with topical treatments, that's when we go to more systemic treatments. And it can be like a light-based treatment, what we call phototherapy, or Dupixent, which is often what it's known. You might have seen it on commercials, but Dupixent injections, which are biologic treatments for eczema that's severe and uncontrolled. Now let's talk about the products that you can find over the counter to help with eczema.
Yes, so what products do you like?
So I'm going to talk about the moisturizing creams that I like. So CeraVe moisturizing cream packed with great ingredients for eczema skin, like ceramides, hyaluronic acid, which is a humectant. I think we talked about it, that helps to bind moisture to the skin and kind of keep your barrier strong. Because remember, eczema patients have deficient skin barrier. So we want to protect that so we can maintain hydration in the skin.
Yep. And I do think that ointments have a big role to play in eczema too. So when I'm looking for ointment to recommend something that's thicker, I will often do Vaseline petrolatum jelly or Aquaphor healing ointment or CeraVe healing ointment. Those are great choices. They're occlusive, which means they're going to perform a protective barrier on the skin and help lock in that moisture. And so they're really good. So if you do it during the daytime, it can be a little bit greasy. So I often recommend patients do it at nighttime, especially on areas that get extra dry, like the elbows and the knees. And for me, I always do my lips because I know the winter makes my lips dry.
Even hands.
Hands are good ones too. Yeah.
If you're dealing with severe itch, there are two products that I like. One is Aveeno Eczema Therapy Itch Relief Balm.
It's a good one.
Yeah, it has colloidal oatmeal, so it helps to soothe the skin. And Sarna Sensitive Lotion, which has permoxine, which helps to relieve the itch sensation.
One hack I'll often tell people for the Sarna in particular is I'll say to keep it in the fridge because you get the like cooling effect of it, and if it's cold, it works even better to help distract you from scratching. For flare-ups, you probably will need a little bit more than just moisture. So again, there's Eucerin Eczema Relief Cream. Another product I really like is from La Roche-Posay. It's a Lipicar Balm AP+. It's really thick, really moisturizing. It has niacinamide in it too, which helps with the inflammation of the skin. And that is a product, honestly, I've recommended it to patients, to family members, to my friends. I use it myself. So yeah, and this is unsponsored, but it's a really good product for eczema.
No, it's a great product, especially for those with sensitive skin. And if you have a lot of allergens, I typically go to Vani Cream.
Oh yeah.
Vani Cream, the moisturizing cream, it's a huge pump and you can use it on the face and body. I mean, I've used it. I've recommended it to my friends. It's great if you have sensitive skin and if you feel that a lot of products irritate your skin.
Yeah, and remember the key with any of these products is going to be consistency, right? So not just the product itself, but how you use it is what's really going to make a difference. And with any good moisturizer, you, again, apply it right after bathing and during the day. You can reapply if needed to keep your skin protected and hydrated. So for anyone with mild eczema or even just like slightly dry skin, I think these over-the-counter products can be really helpful. If, however, you are still dealing with issues despite it, I think it's really important to reach out to other resources to get help. So for example, one resource is the National Eczema Association, which has a lot of great information and support.
Yes, and if you're still dealing with flares while using these over-the-counter products, then just come see your dermatologist. Or come see us.
Yeah. So see your local dermatologist. And I think the great thing to know is there's a lot of options out there in terms of treatment. You know, back in the day, you might have said it was only topical steroids available, but now there's a lot of other alternative treatments, and there's more like long-term lasting solutions too. So make an appointment with your local dermatologist if you are still dealing with eczema flares, because it can significantly affect quality of life.
Yeah. So we hope this video was helpful in helping you understand more about eczema, how to manage eczema, and when to seek treatments.
Yep. So let us know in the comments if you have any questions. Don't forget to subscribe for more skincare and skin health tips with us here at Derm Time. And thank you so much for watching.
Thank you.
Bye.